Hi, my name is Andrea Eleazar, and I'm a second-year undergraduate at Drexel University. And today I'll be presenting my research on heterogeneity and social determinants of health among immigrants to the United States. So I'd first like to start off by defining the term immigrant. An immigrant refers to one who leaves their home country to settle in another. I'll also be referring to them as foreign-born throughout this presentation. So this is a very broad term that encompasses a large, diverse body of people. And the current literature describes certain US immigrant populations that are at higher risk for certain health conditions like cardiovascular disease or diabetes and their contributing factors. But often the immigrant population is treated as a monolith, which is not a very thorough or accurate representation of them as a whole, as the immigrant experience is highly varied. So our goal for this project was to create a comprehensive, more detailed profile of the immigrant population by characterizing the social determinants of health. So we use census data from the 2018 American Community Survey, which we obtained from the IPUMS USA database. And the tables and figures on this poster are a result of our data analysis, which was conducted in R. Table 1 compares the US-born and foreign-born population side by side on a nationwide level and on the Philadelphia level. It includes demographic characteristics like age, sex, citizenship, and also socioeconomic characteristics like education, income, poverty, and unemployment rates, and also English language proficiency. So some key findings nationwide is that there's a notable difference in labor force participation rates. 63% of immigrants are in the labor force versus the US-born 49%. In Philadelphia, similar patterns were found, but 16% of the Philadelphia population was foreign-born, which is higher than the national average. And also the unemployment and poverty rates were higher than the national average, while the median household income was significantly lower than the national average. Table 2 looks at the same characteristics, but breaks down the foreign-born population by their region of birth. So some key findings here is that the largest proportion receiving less than a high school diploma, and the smallest proportion of college graduates were immigrants from Central America. And the largest proportion of college graduates come from India and Southwest Asia. Median household incomes, there's a large disparity there, with 57,000 coming from Central America versus 106,800 from India and Southwest Asia. And also more than half of immigrants from Central America are not citizens, and about 38% of Central American immigrants reported not speaking English well or at all. So our key takeaway from this study is that we found not only disparities between the US-born and foreign-born populations, but also a lot of variability among immigrant subgroups themselves. So in other words, there's a large range in the numbers here, and it can be harmful to make gross generalizations and lump this population together, especially in the context of health where different populations may have specific needs. In future work, we'd like to connect our findings to health, investigate heterogeneity in health outcomes and mortality in this diverse population. And likewise in public health, there needs to be a more nuanced understanding of this population and how their health may be differentially and disproportionately affected. Immigrants come from all walks of life, and no one journey is exactly the same. And our hope is that our work informs future public health work concerning this large population and increase awareness of the broadness of the population and their varying situations and needs. Thank you.